With COVID cases once again on the rise, health leaders coast to coast are trying to pump the brakes on an upward trend.
Hi, it's Dr. Dave Choksi with an update about COVID-19 booster shots.
New Yorkers likely recognize these ads with the city's health commissioner, who's been encouraging boosters for those 65 and older or with underlying health conditions. But now, with backing from the mayor, Dr. David Choksi offering them to all fully vaccinated adults 6 months clear of Pfizer and Moderna or 2 months after the J&J jab, some 4.5 million people.
We've seen throughout the pandemic that we have to stay a step ahead of the virus, and the decision that New York City made was very much in that vein.
That proactive posture coming as Colorado, California, New Mexico, and Arkansas all issued the same guidance, taking a looser interpretation of federal guidelines that allow boosters for high-risk populations. In Minnesota, which has seen a nearly 70% increase in cases the last 2 weeks, the virus is flooding communities, big and small.
We are all full. This is not getting better.
This as Americans try and sort through mixed messaging on boosters.
I think the confusing message around the boosters may end up being one of the biggest missed opportunities in this pandemic.
States and cities are trying to take the lead. The CDC says adults with increased risk of exposure should get the booster, and some local officials say that can cover all adults.
How does New York City have the autonomy to make this decision?
The commissioner's advisory that I issued today is consistent with the FDA authorization and the CDC guidance. An important part of that guidance is about risk of exposure.
Choksi says we're learning from Europe, which tends to foreshadow what happens in the U.S. Cases there rising so precipitously. Austria has imposed a lockdown for unvaccinated people, and Germany is considering the same.
We feel much safer when I know that the people that walking around are vaccinated.
Even with all the talk about boosters, health officials emphasizing the most important shot is the first one.
Medical experts say supply here is not the issue, that cities and states and pharmacies have enough boosters. The question right now is liability. If someone were to get a booster shot that is not federally authorized to do so and has complications, who's responsible? Could it be the state? Could it be the healthcare provider? A lot of unanswered questions. Craig, back to you.
All right, Sam Brockforce there in Florida. Sam, thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.